Welcome to the office.
Hi,
Hi.
welcome back. It's been a couple months.
Yes.
How you doing?
I'm doing good.
What's up?
Been better. Just with the shoulder pain again.
Okay.
Lately I've been like getting it back. It's probably the way I'm sleeping. I'm not sure. I haven't had it for a really long time, but then recently it started coming up again.
What have you been doing? It's been a couple months.
I've been training at the
Okay.
gym.
Okay.
Dieting a lot. Like I'm right now at like calorie deficit, so my food intake
Getting
is
ready
kinda
for
low.
competition?
Yes.
All right. How's the overall body pain from where we started?
Overall, it's great.
Overall good?
Yes.
Digestion is good?
Mhm.
Skin is better?
Mhm.
Good?
Yes.
Okay. And today major is shoulder.
Yes.
You're training hard though, yeah?
Yes.
Okay. Are you doing a lot of weights on your shoulder?
I'm doing shoulder press and stuff like that. So military press. So yes.
Are you doing lower traps?
Not really. No.
Okay, so we're going to talk about that at the end
Okay.
to help the shoulder.
Okay.
Okay, because one of the things when you're working out, you're doing a lot of shoulder stuff.
Mhm.
And one of the things that's going to hold the shoulders back is working the lower traps or the lower part of that V.
Okay. Yeah.
And the easiest way is going to be just doing Supermans on the floor.
Okay.
Okay,
Oh, wow.
and just with water bottles, no weights. In the beginning, do that for a couple of weeks.
Mhm.
After that, then if you want to add like 3 or 5 pounds, you can.
Okay.
Sound good?
Yes.
You ready for me?
Mhm.
Come over here, let's see you walk. You doing your cardio as well?
Yes. Not too much because my trainer said I'm already like too skinny.
Okay.
I don't need that much cardio, but
So you're doing more,
more like walking
okay.
and like on incline.
Walk on your toes, please. Come on. Your right calf seems a tiny bit smaller than your left.
Okay.
Walk on your heels, please. Yep. Okay, come back over here. Let's take a look and see where we're at. Starting at the base. You're doing 6 days a week?
Mhm.
We've come a long way, lady. Come a long way from last year, yeah?
Yeah.
So, upper neck is clear. I am getting the base. C6, C7. We'll do a quick scan at the end too, okay?
Mhm.
You may bruise a little. Did you bruise last time?
Oh yeah.
How long did it last? Sit up
A
straight?
week.
Okay, but it's okay. If you have competition, it's still a little
Yeah.
bit away. Cool. Mid back is good. Your eating's been good. Her skin is looking a heck of a lot better. But you came for something else.
Mhm.
Huh. And there's the sacrum, the tailbone. Okay, let's go ahead and check the hips, feet together. Open and close the knees. Good. Right side only. Left side only. We got a little bit more fixation on this right side. Scoot back for me, please. Okay. So, top of the joint. Bend back towards me on the right. Middle of the joint. Bottom of the joint. More tender there. Yeah. L5 back towards me. Tender. S1. S2 or S1?
That's one.
L5. We're not there. Then down, please. Round your back. One, two, three. You go back to the first vid of just even me static palpation. It's so much better, madam. Very good. Okay. We have sacrum and the base of the neck today. Okay. Now, that's one nice and easy there. Finger, push, home run. Nice. Walk it off, please. That was deep. Walk it off. You can follow it around that way. This is after adjustment. Walk on your toes, please. C7. Nice and easy there. Nice and easy there. Good. That was a great moves. Down. There we go. Nice. Sit up, please. Okay, walk it off 2 more times and then continue. You originally came with a...
Ankylosing spondylitis.
And that's what they told you, right?
Mm-hmm.
Your diet's changed, your diet's been better, so your food intake, all that's changed.
Yes.
You haven't had those symptoms, have you?
No.
Any of those symptoms?
No.
Okay. What we're probably going to do is probably 3 months down the road or 4 months, we're going to re-x-ray at that point, and we're going to make sure there's no bony changes related to that. I don't think there should be, but just to be safe, okay?
Yeah.
3. Yeah, we can do in July.
Yeah.
Go on your back, please. Let's work on your feet. Hi. Right side more, left side more.
Left.
Yeah, right there. Okay. Slide up a little so your ankles are just off the edge. We're testing the ankles out. Dorsiflex. And we're more fixated on the medial side on the left foot. Dorsiflex lateral side, dorsiflex medial side. This side is fine. We're going to work on this ankle. Bend the knee. Bend the knee. Valgus versus stress. Valgus versus stress. Nice. Very cool. Slide over this way. Valgus versus stress. Relax there. We got this right there. Posterior tibia, anterior superior talus, medial tilt. Left side. Slide up, please. Alrighty. You got any questions for me? On anything since we started and all this fun stuff?
How long does it take for the tailbone to actually like sit into place, or
That's a good question. Everyone is different, and it depends on the severity of the misalignment calcification. In your case, we'll see when we re-x-ray it where we're at, right?
Yeah.
And in your situation, we know because of your age, it hasn't fully matured yet. So it's going to be nice when we do the re-x-ray to see kind of where that's at.
Okay.
That's a good question. Everyone's different. And then let's say somebody who just sits all day versus someone who's not active, who doesn't get the movement. The more you move, the better it heals anything.
Yeah.
Let's do the ankle.
I don't know.
All right. Five, 4, 3, 2. So here we're just working the periarticular swelling, the swelling on the outside of the joint. We're on the ankle, the talus. We still have a little bit of scar tissue in here. definitely doing better than before. 5, 4, 3, 2, 1. We'll need to come back to that. Let's do the knee first. We're going to do a posterior tibia. There's a slight bulging of the lateral capsule. So we're going to go ahead and work the swelling first as much as you can handle. You remember all this, right?
Yeah.
All right. Traction, open up the joint. Hi. And the good news is nothing is worse down here, okay? But I think also you've been training.
Yeah.
5, 4, 3, 2. It's getting there. How you doing?
Alright.
5, 4, 3, 2. Hold on to the table, please. Bend the knee. And we're right on the lateral aspect. We're taking the capsule and the tibia, superimposed pisiform. And that's a set, baby. Beautiful. Man. Okay, stand and walk that off once and then go back on your back, please. Madam. Come on your back over here, please. Let's continue. Now, let's go ahead and set that ankle. What's nice, because you can't see this, but I can feel it. From what I did in the knee, this is better.
Yeah.
Right?
Yeah.
It's
when
tender.
I was walking, I was able to feel my feet were like outward a little bit, the way it should.
Yes.
But in the beginning, the speed was like turning a little inwards.
Correct. Now, because we did the knee today.
Yeah.
So lots of backwards pedaling this weekend.
Okay.
Posterior fibula. Turn to your right side. Calcaneus, posterior lateral. Other side, please. Navicular. On your back. We're just going to do this one light. There. Stand up, please. Go on your stomach. So when we're looking at the cuneiforms, we're looking at the middle. Part of the foot issue in foot mechanics is we have a dropped second cuneiform, which causes a slight flattening and a little bit of plantar fasciitis in the fascia. Coming off the third ray. You feel that?
Yeah.
Right there. Let's use the board. Coming off the third. Nice. Down. That's it. Okay, madam. Turn onto your back, please. Uh-huh. Toes back, feet back. We're good there. Okay. Sit up. Let's do the shoulders. Start with the right. Over. Around. There you go. Putting up some big weight. There you go. Over. Around. And you are doing at least 10,000 steps a day?
Yeah.
Perfect. On your back, let's check and scan now. Okay, so take some lotion. We're using a gua sha. Bone comb is what I call it. It's time for the bone comb. Bring this up a little bit, please. Thank you. And you can use lotion, you can use oils. And if you come closer, you can hear this. Come. If it's too much, you tell me, I'll stop. Come here. ये क्या है? हैं? ये चेवड़ा है? Sounds like chevro. That's an Indian snack made of like puffed rice and potatoes. Potato chips and peanuts and all that. Chevra.
Oh.
5, 4, 3, 2, 1. Remember, Vandana, please.
Mm-hmm.
Muscle will only grow according to fascial expansion. I need you to do this for yourself.
Okay.
Okay, you guys can do this to each other too.
Okay.
It's important. You're gonna see, you're gonna bruise today.
Okay.
You're gonna get an awesome swell on your workout this week.
Nice.
You in for it. If anything is too much, you tell me, I will stop. 5, 4, 3, 2, bus. 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 Okay. Just like this. Same thing, now we're on the left side. We want to get listen. Scar tissue. Fascia. 5, 4, 3. And you do know now I'm open every other Saturday, right?
Yeah.
So I couldn't close all Saturday. Move this a little bit.
Oh my god.
Do you see, without doing this, how is your, look at this, how is your muscle supposed to be more, or how is it supposed to be symmetrical?
Oh
Okay. 5, 4, 3, 2, 1, bus. I mean, there's a lot more. I'm going to keep it at that, okay? Now, this is good, okay? If we listen here, it's not so bad. She's been doing good on this leg. A little bit there, not too bad. Good. Behind the knee. Now, good. Same thing here. Good time, huh? Hams. Who knows what the sergeant muscles are? Who knows what the sergeant muscles are? That's a test question for you guys. We call it the sergeant muscles. And they relate to the inside of the thigh, goes into the knee. Whoever knows, let me know. The sergeant muscles. There are 3 muscles. We call them the sergeant muscles. SGT. SGT is short for sergeant, right? 5, 4, 3, 2, 1. Good. Let's view the other side now. Okay, so when we're talking about gua sha, guys, taking a hard surface on soft surface, the intention is to break up adhesions and stagnation. Wherever there's a lot of stagnation, as you can see here, look, it's bruising or getting redder on this side. So the right side is a little more stagnant than the left in the hamstring. Good. And there are a lot of different ways to do this. There are a lot of different combs or appliances you can use. The whole idea is get in there and break up adhesions. And, you know, they did do research many, many years ago. And they did find that, for example, there's nerve pressure at the fourth lumbar. And wherever that fourth lumbar went, they found pressure there. It created all those side effects such as adhesion, scar tissue, spasms along that L4 nerve distribution. And then when they got rid of that pressure, guess what? A lot of that stuff went. So then the question is, why do we have to do these procedures? Because people won't give themselves the time to actually heal. Right, Vandana? You know what I mean? Yeah.
So if you're able to take the pressure from the nerve, will these adhesions go away by themselves?
Yes, correct. Okay. That's the theory, okay? And that's the research that they did. However, if we don't also change these lifestyles, what happens?
Then they get worse.
Then they come back. Yeah. So we can get the pressure off the nerve, right? Yeah. We can get the pressure off the nerve. We can see the adhesion start to go, and I've seen it many, many times. At the same time, muscle girth changes. But we go back to the same postures and habits. What happens? We get the same shortening of the ligaments in those adaptive positions. 5, 4, 3, 2, 1. Very good. 5, 4, 3. Great. Madam, let's walk like this. More better?
Yeah.
Alright, why don't we come back over here, have a seat, let me re-scope you, make sure everything is good. Mm-hmm. Sit up straight. Looking good. Ears and shoulders. Yeah, shoulder. There you go. Good. AI shoulder, anterior inferior. Down. There. Okay, madam. Check the hands. Squeeze. Squeeze. This is good. Squeeze. Elbow. Posterior humerus. Nice. Squeeze. Squeeze. Squeeze.
Ooh.
Squeeze. Squeeze. Still scaphoid. There you go. That's crunchy.
Why is that?
I need a little more in your neck. Have a seat, please. Oh, sit back for me. I just want a tiny bit more in the neck just to get a little more power on for you. Let's do this. Right ear down. Good. Oh, check it out.
Yeah.
Tell her, not me.
It's different.
It's more power.
Yeah.
Squeeze. Squeeze. We're all set.